The next step in the fight against COVID, CDC advisors voting to recommend the Pfizer COVID-19 booster shot for children as young as 12.
The vote comes days after the FDA gave its approval, and all the booster recommendation needs now is the approval of CDC Director Dr. Rochelle Walensky.
The news comes as more outbreaks are being reported at our schools.
Grand Blanc and Flushing high schools are joining the list of new outbreaks, along with Countryside Christian in Gratiot County. The majority of school outbreaks in mid-Michigan since September are in the region's biggest districts. Officials say the state is averaging more than 13,600 cases per day, a record.
A local health expert tells TV5's Kendall Keys the recommendation comes at a crucial time.
It moves us one step closer to having this behind us instead of stuck in the thick of it like we are.
A panel of CDC advisors gives the COVID booster a thumbs up for kids as young as 12. They voted today to recommend the Pfizer booster be offered to young teens 5 months after their last shot.
The better the immunity in that 12 to 15-year-old, the less likely they are. The viral load is less, so the less likely they are to spread it to other adults that are perhaps more susceptible.
Dr. Bobby McCamala, a Flint area physician, says this recommendation is timely as pediatric COVID hospitalizations rise.
There was a time last year where our local children's hospital had no kids in it. Now they routinely have 3 to 5 kids, some of whom are really sick, right? So it's not zero. It's low, but it's not zero.
How much of a difference does being boosted make versus being just vaccinated?
A dramatic difference, especially with things like Omicron. And so they've seen that, like the Moderna vaccine, for example, the effect of that with just those 2 doses has dropped dramatically against Omicron, but then it goes right back up as soon as you get boosted.
Dr. McCamala says when adolescents get boosted, adults are safer.
The adult with diabetes, the adult on immunosuppressive medication for rheumatoid arthritis, the one that's on chemotherapy, they will be protected when the kids are more protected.
For WNEM TV5, I'm Kendall Keys.
Updated vaccine trial data on children under 5 is expected in the next 6 months.